Nosebleed, epistaxis. Nosebleeds, also called epistaxis, is a symptom. It can occur easily because of the location of the nose and the close to the surface location of blood vessels in the lining of your nose. Most nosebleeds can be handled at home, but certain should be checked by a physician. A nosebleed is blood loss from the tissue that lines your nose. It can affect both nostrils, but most often occurs in only one nostril. Usually, a nosebleed is not serious. Types of nosebleeds. Nosebleeds are described by the site of the bleed. There are two main types and one is more serious than the other. Anterior nosebleed. It starts in the front of the nose on the lower part of the wall that separates the two sides of the nose, called the septum. This is the most common type of nosebleed and is usually not serious. These nosebleeds are more common in children and are usually able to be treated at home. Posterior nosebleed. It occurs deep inside the nose. This nosebleed is caused by a bleed in larger blood vessels in the back part of the nose near the throat. This can be a more serious nosebleed than an anterior nosebleed. It can result in heavy bleeding, which may flow down the back of the throat. You may need medical attention right away for this type of nosebleed. This type of nosebleed is more common in adults. What causes nosebleeds? Two of the most common causes of nosebleeds are dryness, often caused by indoor heat in the winter, and nose picking. These two things work together. Nose picking occurs more often when mucus in the nose is dry and crusty. Colds also can cause nosebleeds. Less common causes include injuries, allergies, or the use of illegal drugs, such as cocaine. Children may stick small objects up their noses, and that can cause the nose to bleed. Pregnant women. Blood vessels in the nose expand while pregnant, which puts more pressure on the delicate blood vessels in the lining of the nose. People who take blood-thinning drugs, such as aspirin or warfarin. People who have blood clotting disorders, such as hemophilia or von Willebrand disease. Treatments for nosebleeds. Treatments depend on the cause and could include nasal packing, gauze, special nasal sponges or foam, or an inflatable latex balloon is inserted into your nose to create pressure at the site of the bleed. The material is often left in place for 24 to 48 hours before being removed by a healthcare professional. Cauterization. This procedure involves applying a chemical substance, silver nitrate, or heat energy, electrocautery, to seal the bleeding blood vessel. A local anesthetic is sprayed in the nostril first to numb the inside of your nose. Prescriptions. Reducing or stopping the amount of blood-thinning medications can be helpful. In addition, medications for controlling blood pressure may be necessary. Tranexamic, Listidat, a medication to help blood clot, may be prescribed. Ligation. In this procedure, the culprit blood vessel is tied off to stop the bleeding. Nosebleed care. Sit upright and lean forward. By remaining upright, you reduce blood pressure in the veins of your nose. This discourages further bleeding. Sitting forward will help you avoid swallowing blood, which can irritate your stomach. Gently blow your nose to clear your nose of blood clots. Then spray both sides of your nose with a nasal decongestant containing oxymetazoline, Afrin. Pinch your nose, use your thumb and index finger to pinch your nostrils shut. Breathe through your mouth. Continue to pinch for 10 to 15 minutes. Pinching sends pressure to the bleeding point on the nasal septum and often stops the flow of blood.